Good evening and thanks for joining us here at 5:30. I'm Adam Clements.
And I'm Kyle Linsky in for Megan tonight. America's top doctor announcing this week that the CDC is considering adding a recommendation for a negative test before ending quarantine after having COVID-19.
The CDC just shortened the isolation time from 10 days to 5 days, provided that the person who was infected wears a mask for the other 5. As medical reporter Liz Bonus explains, this is raising some questions about the next steps to stop the virus from spreading.
Hey there, everybody. If you're confused over changing guidance, you are not alone. With so many of us in search of testing, I did ask several healthcare providers today about what to do if you're not able to be tested at times when it's recommended, and some of the practical steps to take for our own safety, tested or not. A negative test wasn't part of the initial 5-day suggestion to return to work or school for a number of reasons. First is that if you get a test like this one called a PCR test, which is sent to a lab for analysis,
the PCR tests can stay positive for much longer than you are infectious. In fact, picking up tiny little pieces of RNA for weeks, if not months, when you are perfectly well to return to work.
The second is that if you use an antigen or a rapid test,
the FDA is still evaluating the accuracy and sensitivity and specificity for the new Omicron variant.
The third is that with Omicron spreading so rapidly, demand is exceeding supply. Dr. Cameron Webb says at-home test kits expected to be available to 500 million families soon.
Our response in terms of surge really is predicated on what states ask for. We work really closely with state leadership, find out what they need, and try to meet the mail.
So if you are sick or exposed to COVID-19, public health providers say here's a few practical suggestions. Get an initial test so you can get early treatment for COVID-19 if needed. Continue to isolate after 5 days and call your doctor if symptoms are not improving. And if you're not symptomatic after 5 days, still wear a mask for the other 5 days when you return to daily activities. The concern, of course, is that if steps aren't practical, people simply won't do whatever they can to try and help lower risk. I'm medical reporter Liz Bonus. Now back to you.